Introduce Dr. Jonny Garcia, who's coming to us from Colombia and is going to be talking about an mHealth strategy in sexually transmitted infections testing. Welcome.
So, good morning, and thank you for the opportunity to present today. I'm Jonny Garcia, a dermatologist from Colombia, and I'm going to talk about the development of mobile health solutions for STI testing in Colombia. So, sexually transmitted infections are dermatological conditions with a massive public health burden. Every year, they affect over 350 million people, causing 2 million deaths, and affecting 350,000 babies as these newborn with congenital syphilis at our hospital in Cali, Colombia. So to understand STIs, this graph shows sexually transmitted, like sexual networks, where the big red dots are members of core groups with a high number of sexual partners. Testing and treatment, in particular for core groups, is key for the control of STIs. As you can see in the figure, if we test and treat at time 1, we will avoid the cases at time 2 and time 3. But what is going on with testing and core groups in Colombia? We don't really know. Surveillance is limited to HIV, viral hepatitis, and maternal and congenital syphilis, and other STIs are treated syndromically, and we don't have data on them. So we did a prevalence study using respondent-driven sampling. That is a method that uses peer recruitment and keep track of the referral change to estimate the prevalence. We recruit adult transgender women. We collect data through a survey, and we collected samples for STI testing. We recruit 169 transgender women, and we found a striking prevalence of STIs. Two big examples. The HIV prevalence was 40%, with 25% of the participants unaware of their status. And the positivity of treponemal test was 70%, with 16% of the population considered as having likely active disease. Despite the high risk, this community had a low testing rate. Only 50% of the participants had been tested for any STI, including HIV, the year prior to enrollment. And regarding lifetime testing, despite 70% had been tested for syphilis, less than 20% had ever been tested for viral hepatitis, and less than 1% for gonorrhea or chlamydia. Also, discrimination was common in this community, and 34% were discriminated by a healthcare provider. So we have a high prevalence, we have low testing rates, and we have discrimination at healthcare facilities. What can be done? So mobile health solutions are a promising tool to reach marginalized communities like core groups, like transgender women. They have shown to increase the uptake of preventive services and testing, but their scalability is limited by the lack of interoperability with the health system and the effort required to download and learn to use additional applications. But the solution is already in our hands. Like most people who have access to internet in Colombia have access through smartphones, and WhatsApp is the preferred method of communication in general and among transgender women. And this application is already being used by private clinics in Colombia to facilitate home-based testing for any disease. So our next steps is working with the community to co-develop a person-centered strategy to use WhatsApp to deliver education, support engagement, facilitate testing, and linkage to care. And that's what we plan to do for the Therapy Access Grant. So in conclusion, testing and treatment of core groups is key for the control of STIs. mHealth tools are promising solutions to reach marginalized communities, and we need more research to evaluate WhatsApp-based strategies. So this is a collaborative effort with colleagues in the US and in the UK, and we have been funded by the US NIH. Thank you again for the opportunity to present today, and thank you to Niraj, who has been a wonderful mentor over the last year.